And the wildfire smoke is, of course, prompting several air quality advisories. We're going to take a closer look at that now with Dr. Ann Hicks. She's a pediatric respirologist and assistant professor at the University of Alberta. We've reached her in Edmonton. Thanks very much for being on the program today.
Thanks for having me.
So I want to begin with the effects of the wildfires, smoke, air quality concerns. What does all of this do to our lungs?
Sure. Well, I think there's a couple of ways of thinking about it. So wildfire smoke has a lot of ultrafine particulate matter that can be breathed deep into the lungs, maybe a little bit more than some of our general air pollution. And it can also contain a lot of toxic compounds that cause inflammation in our airways and in our lungs. So for everybody, you get irritation, so your eyes burn, your throat burns and itches, you get a cough and extra mucus production. For people with heart or lung disease, that inflammation can be local and it can also be systemic, so it can impact how your body functions. And for people with asthma or COPD, it can make you have an exacerbation or an attack.
And of course, you're a pediatric respirologist. We know some groups are more vulnerable to poor air quality than others. What about children? How are they impacted when they're exposed to levels of wildfire smoke like what we've experienced this year and even last year?
Yeah, kids are a little bit different than adults for a couple of reasons. One of them is that they're breathing faster normally, so they get more pollutants per kilogram of body mass when they're exposed to things like wildfire smoke. They also have more likelihood of playing outside, breathing harder, running more, and things like that. And they have less control over where they are. So kids are less likely to be able to get out of a smoky environment or an overheated environment, which can impact them. The final thing is that kids are still growing and developing. And there's growing evidence that during different phases of development, including some parts of fetal development and some parts of early childhood development, you can have a longer-term impact on the lungs, especially with longer-term exposures to air pollution, including wildfire smoke.
Yeah, I want to pick up on something you said there about fetal development. We know pregnant women are also at particular risk. What are the particular concerns there?
So there's a few studies that show that pregnant people in the first and second trimester especially will have an increased risk of having a baby that's called small for gestational age, meaning that they're significantly smaller than expected, which actually increases the lifelong burden of heart disease as those infants become adults. There's also some increased risk of having the baby early, so preterm delivery or birth. And when children are significantly preterm, again, they face lifelong health risks because of that. And it's riskier for the pregnant person to be having a preterm pregnancy as well.
Man, you know, it's so much to think about. During the course of all of these evacuations and seeing the devastation of the fires, it's a lot, especially for people who are from the communities that have been affected. As a doctor, I just want to ask you, when you're watching all of this unfold and the effect of wildfires, wildfire smoke, but everything else that surrounds it, what are your biggest concerns about the effects here, the evacuations, the smoke, the damage, the mental health of all of this?
Oh, there's so many possibilities. I think, early in the evacuation, we can take steps to help protect people from wildfire smoke and poor air quality. But the truth is that people who are evacuated are displaced in the most stressful circumstances imaginable. And when they are displaced, they have very little opportunity often to grab the things that they need. So in the short term, we worry a lot about people having their correct medications, access to medical care. And again, as you mentioned, the stress. There's a study out of Australia that showed that in the first 6 months after an evacuation, school kids had PTSD, or up to 50% of them had some elements of PTSD. Certainly, in the longer term studies that have been done in Canada, some of those anxiety and mental health situations are extended for kids. And I think, again, we need to be really forward thinking. We need to consider it a possibility and support people to prevent or get them through these and help them recover as best as possible. The other thing is that people have been displaced or displaced for a really long time. So, making sure that they have access to their medications, job situations change, living situations change, making sure that they have those safe spaces where they can best recover. And the last piece is, especially for somewhere like Jasper, where so many Canadians have such strong ties, we have to remember that the people who live there should come first, and we all have an urge to rush back and make sure things are okay or something. But let them get settled and do what the first responders need us to do to make sure that everybody can get home or rebuild as safely as possible.
As we watch this, you can never be prepared for something like this. But I only have about 30 seconds left. But is there any advice you have for people in terms of thinking ahead and protecting themselves, particularly when it comes to wildfire smoke?
I think it's really important to always be ready to hear what people are saying. So, if an area is wildfire impacted, we need to be ready to change our plans, have alternative plans available, and really high quality plans, not just a kind of stay home thing if it's smoky outside. We need to make sure that for people with medical conditions that they're on top of their regular medicines and that they have their exacerbation medicines present at all times. And I think we just need to have a lot of understanding and support for each other through these very difficult times.
Dr. Ann Hicks, pediatric respirologist and assistant professor at the University of Alberta. Thank you.